Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Types of urinary incontinence and how to find relief. Urinary incontinence, UI, or the loss of bladder control, is a condition that affects roughly 25 million people living in the United States. Though females are twice as likely to experience UI than males, particularly females over 50, certain types are known to affect males more than females. /r/n/r/n Managing UI can be frustrating because there is no one-size-fits-all solution for every type of incontinence. This includes the 5 major types: stress incontinence, urge incontinence, mixed incontinence, overflow incontinence, and functional continence. /r/n/r/n The first step in finding the right treatment is to obtain a correct diagnosis, either from a urologist trained in disorders of the urinary tract or a specially trained obstetrician-gynecologist known as a urogynecologist. /r/n/r/n This article describes the 5 types of urinary incontinence, including how each is diagnosed and treated. /r/n/r/npuckons, Getty ImagesrnrnrnVerywell Health acknowledges thatsex and genderare related concepts, but they are not the same. To accurately reflect our sources, this article uses terms like male, female, men, and women as the sources use them. /r/n/r/n Stress incontinence, also known as stress urinary incontinence, SUI, is the most common type of incontinence, particularly among younger women. It is not caused by emotional stress but rather by physical activities that place stress or pressure on the bladder, causing accidental leakage. /r/n/r/n These include physical actions like /r/n/r/n SUI happens when the muscles at the bladder neck, called the urethral sphincters, and the muscles of the pelvic floor are weak. This allows urine to seep into the urethra, the tube through which urine exits the body, typically in smaller amounts. /r/n/r/n The diagnosis of SUI involves a review of your medical history and a physical exam. As part of the evaluation, you may undergo a urinary stress test in which you are asked to cough or bear down to see if there is any bladder leakage. /r/n/r/n Other specialized tests, like postresidual urine volume, PRUV, may be ordered, but these are less commonly used for uncomplicated cases. /r/n/r/n SUI is usually treated conservatively with pelvic floor exercises, fluid management, weight loss, vaginal pessaries, and other devices. Severe cases may benefit from injectable urethra bulking agents or surgery. These treatments are described in detail later in this article. /r/n/r/n Urge incontinence, also known as urge urinary incontinence, UUI, is the sudden, uncontrollable urge to pee that causes bladder leakage before you can get to the bathroom. UUI is more common in older females and the most common form of urinary incontinence in males. /r/n/r/n Urinary urgency is often accompanied by urinary frequency, in which some people may need to rush to the bathroom more than 8 times a day. Unlike SUI, UUI typically involves larger volumes of urine. /r/n/r/n UUI is caused by the hyperactivity of the muscle that contracts the bladder walls, called the detrusor muscle. It may be due to a prior bladder injury, irritants, infections, or conditions that damage the nerves that regulate the detrusor muscle. /r/n/r/n Common risk factors for UUI include /r/n/r/n UUI may require extensive testing, including /r/n/r/n In addition to pelvic floor exercises and fluid management, the treatment may involve medications to ease bladder spasms and bladder training to teach you how to hold it in. Surgery is a less common option reserved for severe cases. /r/n/r/n Mixed incontinence, also known as mixed urinary incontinence, MUI, is when you have both stress incontinence and urge incontinence. MUI affects roughly 30% of females and 50% of males with urinary incontinence. /r/n/r/n MUI is harder to diagnose and treat because the underlying cause is multifactorial. It is also more disruptive, with 1 in 3 affected women reporting signs of chronic depression. /r/n/r/n MUI is usually suspected when a person answers yes to the following 2 questions. /r/n/r/n A urodynamic study is central to the diagnosis of MUI. This is a battery of tests that includes a urinary stress test, uroflowmetry, which measures how fast you urinate, cytometry, which measures the pressure inside the bladder, and post-void residual volume, which measures how much urine is left in the bladder after peeing. /r/n/r/n While useful in differentiating MUI from SUI or UUI, a urodynamic study cannot diagnose MUI on its own. Additional tests and clinical expertise are required to render an accurate diagnosis. /r/n/r/n The treatment plan varies based on the severity of symptoms. With that said, the antidepressant Cymbalta, duloxetine, has proven effective in people with MUI, easing both the frequency of bladder leakage and the severity of depression symptoms. /r/n/r/n Overflow incontinence, also known as overflow urinary incontinence, OUI, is leakage that occurs because the bladder is overfull. People with UUI experience leakage without the urge to urinate and tend to be unable to fully empty their bladder. /r/n/r/n Unlike other forms of incontinence, UUI is more common in males than in females. /r/n/r/n UUI occurs when the bladder is overfilled due to an obstruction, a weak detrusor muscle, or a neurologic condition that blocks signals to the brain telling it that the bladder is full. /r/n/r/n Common causes of UUI include /r/n/r/n The diagnosis of UUI is similar to other types of incontinence. However, a type of X-ray called a voiding cystourethrogram, VCUG, is especially important as it can visualize the bladder as it fills and empties. This can help confirm the diagnosis of UUI. /r/n/r/n The treatment of MUI involves bladder training, pelvic floor exercises, and catheterization to help empty the bladder. Medications can help shrink an enlarged prostate, while surgery can help treat blockages caused by tumors, fibroids, or vaginal prolapse. /r/n/r/n Functional incontinence is the loss of bladder control arising from the inability to get to the toilet in time due to a physical or cognitive problem. It may be because a person has a physical disability or does not realize that they need to pee. /r/n/r/n Functional incontinence is largely associated with older people who may be frail and experiencing cognitive decline, but it can also affect younger people for different reasons. /r/n/r/n Causes of functional incontinence include /r/n/r/n Functional incontinence can be diagnosed based on physical or mental impediments that prevent you from getting to the toilet on time. /r/n/r/n Even so, additional tests may be ordered to check for other forms of incontinence, such as SUI, UUI, or UUI. This is especially important for people who are bedbound, are non-communicative, or have dementia or intellectual disability. /r/n/r/n The treatment of functional incontinence varies by the cause. Some people may benefit from assistive mobility devices, occupational therapy, assisted living, or simply moving closer to the bathroom. /r/n/r/n Functional incontinence can refer to both urinary incontinence, the loss of bladder control, and fecal incontinence, the loss of bowel control. The same causes can lead to both. /r/n/r/n Many treatments are available for urinary incontinence. Some are useful for all forms of incontinence, while others are specific to certain types. /r/n/r/n Studies suggest that up to 70% of incontinence cases can be relieved with changes in certain behaviors and lifestyle habits. Even if complete relief is not achieved, These changes can improve your overall response to treatment compared to doing nothing at all. /r/n/r/n These include /r/n/r/n. A number of products are available over the counter, OTC, and through medical retailers to help control bladder leakage. These don't actively treat incontinence but can help you avoid the embarrassment of an accident while at work, at school, or in social situations. /r/n/r/n. These include /r/n/r/n. The National Association for Continence offers a toll-free hotline that provides medical referrals to people with incontinence and listings of local and online retailers that carry incontinence aids. Call 1-800-BLADDER or visit www.ur.org/r/n/r/n. Transcutaneous electrical stimulation, TENS, is a non-surgical treatment commonly used to treat incontinence. It involves placing electrodes on the muscles that control urination. The gentle electrical pulses are thought to strengthen the muscles. /r/n/r/n. The electrodes can be placed on the vagina, penis, rectum, or sacrum, the triangular bone at the base of the spine. Studies have shown that stimulating the tibial nerve at the outer ankle and foot may also help. /r/n/r/n. Despite showing promise in studies, TENS's effectiveness varies significantly, and its benefits remain unclear. Even so, TENS is considered safe and non-invasive and can be self-administered in the comfort of your home. /r/n/r/n. Many different medications can be used to treat urinary incontinence. These are generally prescribed when bladder leakage cannot be controlled with lifestyle changes or your quality of life and well-being are being compromised. /r/n/r/n. Some of the drugs are taken orally, by mouth, while others are delivered by injection or transdermally, through the skin. /r/n/r/n. Currently, no medications are approved for the treatment of SUI in the United States. However, people with MUI or PRUV often respond well to drugs like /r/n/r/n. There is no specific drug treatment for WI, but people with an enlarged prostate may benefit from alpha blockers that relax the bladder neck and improve urinary flow. These include oral medications like Flomax, tamsulosin, urethral, alfuzosin, Rapiflow, silodosin, and Cardura, doxazosin. /r/n/r/n. Another treatment sometimes is a product called a urethral bulking agent. Used mainly for SUI, this involves the injection of a substance around the opening of the urethra to narrow it. The narrowing helps prevent urine from escaping. /r/n/r/n. Different bulking agents a urologist can use include /r/n/r/n. Of the four, polydimethylsiloxane is often preferred because it is permanent, while the others require additional injections after the first year. /r/n/r/n. Surgery is generally the last resort for treating urinary incontinence. There are different types of surgery for different conditions. Some procedures may be combined. /r/n/r/n. Many procedures can be performed laparoscopically, using small keyhole incisions, narrow surgical tools, and a lighted, fiber optic scope. Other procedures are transurethral, meaning the surgeon accesses the bladder through the urethra. Others still are open surgeries involving a large incision. /r/n/r/n. Surgeries used to treat SUI include /r/n/r/n. Surgeries used to treat UUI include /r/n/r/n. No specific surgeries are used to treat WI, but different types can be used to clear blockages or reduce external pressure on the bladder. Examples include /r/n/r/n. The five major types of urinary incontinence are stress incontinence, urge incontinence, mixed incontinence, overflow incontinence, and functional incontinence. Each has different causes, diagnosis methods, and treatments. /r/n/r/n. While some treatments, like pelvic floor exercises and fluid management, are useful for all types of incontinence, others, like medications and surgery, are specific to each type. It is important to seek a diagnosis from a urologist or urogynecologist. A treatment for one type of incontinence may not work for another. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.